Dentistry can help you replace those failing or missing teeth with a beautiful smile and the confidence you deserve. The doctors at the South Florida Center for Periodontics and Implant Dentistry have helped thousands of patients rejuvenate their smiles for nearly 30 years by replacing failing and missing teeth with dental implants. Often new teeth are replaced the very same day using the technique they pioneered more than 15 years ago. Teeth today. At the South Florida Center for Periodontics and Implant Dentistry, all of their doctors are board-certified dental specialists. They have placed thousands of dental implants, and we all know that experience matters. Call the South Florida Center for Periodontics and Implant Dentistry today to schedule your free consultation. Call them at 561-912-9993. You'll be glad you did. You are listening to the Ask the Experts show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
Wow, we're back. That was quick. Got to catch my breath. Hey, this next show, this is the South Florida Center of Peridontics and Implant Dentistry. And we had a call after the show. I guess it was 2 shows. And I am going to call you tonight, and I'm going to give you the phone number in case you lost it. So I know the caller knows who they are. We've got Dr. Fred and Dr. Jeff. And today, if you'd like to make a phone call, we're talking dental implants, we're talking periodontal surgery. And you can call us here at 888-565-1470. I had an email from 2 different people, 2 different email addresses, with the same question. They had dental implant work here in South Florida. They didn't say what. Not happy. Can they come to you?
They can. One of the cornerstones of what we do in our practice is problem solving.
They must have been really unhappy, too.
Well, there are different degrees of unhappy, but the bottom line is we want our patients to be happy, obviously, but if there are problems with other patients, we're happy to help patients as far as problem solving is concerned. We pride ourselves on being good at diagnostics and being able to triage patients and point them in the right direction, whether it's something that we can specifically help them with or if we need to get them to a proper restorative dentist to help them. So that's essentially what we try to do. As far as them being unhappy, unfortunately, there are a lot of people...
Not unhappy with you.
No, but there's...
It does happen. To you. I thought that was a nice compliment.
But the bottom line is that there are a lot of people placing implants today with more or less training, depending upon the person that they see, and more or less experience. And the reality is that training matters and experience matters.
Wow. So I was surprised because 2 different people were asking the same question. And you know what? Because I look at this, because we have a show in Miami also, I notice a lot more dentists that didn't have on their bio that they did dental implants. Might have had cosmetic dentistry, but they didn't have dental implants. And I'm seeing more and more dentists just put that dental implants up on their website.
Well, just because it's there doesn't mean there's any great expertise in it.
Exactly.
And it does happen to be one of our areas where we have a lot of experience and we have a tremendous resources in order to solve problems.
You don't do general dentistry.
We don't do general dentistry.
You strictly just do the periodontal, the gum disease, and the dental implants. Is that right?
Correct, but we also see a load of general dentistry because all our patients have dentistry, so we know a lot about it. And we know how to integrate implants and dentistry together. And sometimes you don't need more implants. Sometimes all you need is a good plan to use what you've got. And we're good at creating those opportunities or maximizing what's there too.
Well, that's what we preach. This is all you do. And there's not another dentist out there with 10 shingles going down. We do Invisalign, we do orthodontics, this is all you do. And I think when choosing someone, that's the best route to go because that's all you do.
Right. And I always tell my patients, your general physician could deliver your baby. They're very capable. They've been trained, and they can do it if the mom's healthy and the baby's healthy and everything goes perfectly. But when push comes to shove and you're having a baby, you want to have a well-qualified OBGYN there that can take care of it and make sure that everything's done smoothly. It's the same thing with dental implants and periodontal work. You want to see someone that's
who's going to tell
trained.
us today about the practice? Because we're always getting new people. Tell us about your practice.
Our practice is in Boca Raton.
This is the movie star now that's talking.
Yeah, we have a little bit of showbiz in the office
Yes.
too, but not too often. But we are 4 periodontists, all board certified, and we
Tell everybody, because you just kind of went over it. You're board certified. There's a lot more to being board certified than just we're board
There
certified.
is.
Tell people what that means.
Every dentist learns a little bit about treating gum disease or periodontics. They learn a little bit about dental implants, and they learn a little bit about all phases of dentistry. If you want to be a specialist, then you have to go and do a residency. A residency means that you commit to doing a 3-year advanced education program
Wow, that's a
beyond
long
dental
time.
school. And not only that, all of us in our office have done an additional residency on top of that, which is pretty unique among dentists. So each of us has at least 2 residencies beyond dental school, either 1 or 2 years for the first one and 2 or 3 years for the second one. After you finish the special training program, you can then sit for an examination, which is done by the specialty boards, and say and complete that. And it's a 2-part process. Once you finish that, you can call yourself board certified. About half of the periodontists in America are board certified. There are only about 7,000 periodontists in the country to begin with. So this is like a pyramid. And in the dental professional world, the general dentists are at the base.
Right.
And the specialists are another level up. And then the board certified specialists are a level beyond that. And that typically means that we have more training, more education, and take our profession seriously, because we're constantly students, we're constantly reading, we're constantly comparing notes, we're constantly in touch with our colleagues, and we always want to get better. And
I'm going to have to ask this. I always feel like if I was out, I would want to know. I would hear board certified and go, oh, they're going to be the most expensive because they're board certified. I'll bet you that's not true.
Fees are not necessarily based upon board certification or
Okay.
not being board
That's
certified.
what I wanted to hear.
That we don't
people
set
think
fees
that, though.
based on that. But what it means, as Jeff said, is that it's a certain level of expertise, a certain level of prestige, and there's a certain level of ongoing learning that goes along with it, because we have to recertify every 7 years. So it's not like we're just awarded a board certification, become what's called a diplomate, and that's it for the rest of our career. We have to recertify and recertify and recertify through a written exam on a regular basis to show that we are keeping up with the latest studies, the latest and greatest of what's within our profession. So
It just led
it's a
me into
commitment.
something. I want to hear about this digital X-ray system that you have.
Well, we have a number of digital X-ray systems. So the most basic or the most generalized type of X-ray system that we have is what allows us to take regular dental X-rays, but instead of using film like most dentists used to, or all dentists used to, and then having to process it with chemicals, instead we're able to take them digitally, which means dramatically less radiation for the patient, but it also means that we can get a much more vivid and crisp image.
That's
and then we
important.
can play with that image. We can share it between ourselves and colleagues. We can find a lot more diagnostic data. Beyond that, we have 3D imaging, meaning we have a CT scanner in the office, which many periodontists and oral surgeons today have in their practice, and even some restorative dentists. But the reality is that we were the first kids on the block to have one. We're now on our third, in fact. Fourth, forgive me, I'm losing count. Fourth scanner, because we want to make sure that we maintain the latest technology, getting the best images, again, with the least amount of radiation exposure for our patients. And on top of that, we have other type of digital software, digital imaging applications, including digital impression taking. So we no longer necessarily have to fill a tray with with material and take a traditional impression on patients. Although we still do in many instances, we also have the ability to do it digitally, which offers us a degree of accuracy and being able to reproduce models and of what that patient looks like over and over again. And then photography is a very important part of what we do also, being able to take digital images and then examine them not only with one another, but also to share it with our patients. So we use digital technology on a number of fronts, and we do other things with it, what's called digital mock-ups to see what our patients are going to look like. We integrate a lot of this to actually do a lot of surgical planning. So I always explain to my patients that when I do an implant surgery, by the time I do it on them, it's usually at least the third time that I've done it for that specific patient. And I say that because we'll do it at the time of the exam to get a quick idea of what we can or can't do, what some of our limitations are. And then we'll do it again quietly when we're doing the true plan for the case. And even before we walk in the day of the procedure, we'll go back and do it again, usually very quickly, just to make sure that we're comfortable with everything that we've already done through the first two steps. And I think Jeff will attest that we'll sometimes do it a fourth time. So we treat that patient many times before we treat them for the first time.
You know, I don't know if this was last month. I think you were both here. We get people say, "Oh, I loved your show today." I mean, they'll just say, "Do you know what portion of the show people loved? It was the mindset when you're missing a tooth or you're missing several teeth of how you feel." Remember we were talking about how you don't smile? People love that. Because I didn't even think about that until we started talking about it, that it's really a head trip for a lot of people, missing teeth.
Yeah, it can be really devastating, and some people are very conscious about it. It's a very subtle change, and some people change their smiles, like they make their lips droop to cover over a space,
right?
Where they stop smiling. If you're wearing some kind of dentures and they slip, then your diet may change so that you don't chew fresh fruits and vegetables. I had a guy that was in dentures for a long time, and we just replaced everything with some implants and fixed teeth. And I have a video of it that he said, "I forgot how much I missed corn, or how much I used to love corn, and I just wiped it out of my possibilities,
right,
because I just never thought I'd have corn on the cob anymore."
Right, exactly.
Well, that we take that for granted if
yes.
you have a healthy mouth. But if you're missing a tooth or a teeth, or things are moving, or you're self-conscious, you stop kissing people, you stop smiling, you have a negative self-image sometimes, and it really is challenging. But it's also really easy to fix. And we tell people all the time, the hardest thing to do is pick up the phone.
Right. Make that appointment.
Call us. We'll get you in. We understand. We know how difficult this has been, and we'll get you through this.
It's got to be really difficult for a younger person, I would think. Maybe someone who's out in the dating world out there.
It's funny. I had that patient earlier on Tuesday, I believe. And she's a 36-year-old girl who lost her upper teeth, and she's wearing a denture.
Yeah.
And she can't get scheduled fast enough. I think she would have done it Tuesday afternoon if I was willing to stay and do it at 6 o'clock. But we have some planning to do, obviously, to make sure it's done properly for her.
Right.
But the bottom line is, here's a young, bright, vibrant girl, and it is defining her life. And it's not fair.
Let's use her as an example. From the time she comes into your office till the time she comes out smiling, how long a period is that?
She's going to leave our office when we do the work, which is about 10 days or 2 weeks out based on her schedule. She's going to leave our office that day with 4 implants. She's going to leaving
that day.
She's going to leave our office with teeth that are screwed into place. They are not going to come out. She's going to have fixed teeth when she walks out of the office. So she's going to walk in with the denture.
So she won't have to put any of the glue.
No. The denture is going in the garbage day of surgery.
The day of?
Day of surgery. It's going in the garbage.
And for the rest of her life, they will be her teeth.
And then how long after that?
She's going to heal for probably about 3 months. Then she's going to see her dentist to get the permanent teeth. But she will always have teeth. And so we coined the term teeth today. She's going to leave with teeth today. She's going to leave with teeth that don't come in and out. She's going to go home that night and be able to eat a reasonable diet.
Now, why does she go to a dentist, though, after that?
We make the temporaries.
Okay.
And we want to let the tissue and the bone heal, meaning
Because there's got to be swelling.
There'll be some swelling, not as much as she expects. In other words, she's a teacher, and I told her she can go back to work. We do it on, I think we're doing it on a Thursday. She could certainly go to work on Monday. She could go the next day if she chose to, but she'll probably wait and go back on Monday. Bottom line is, she'll have some soreness, not a lot of pain. She'll have some swelling, not too much. She should be able to keep her plans for the weekend. So as far as social plans, go to a movie, go to dinner with friends. She'll be able to eat reasonably. Nothing that makes noise, nothing crunchy, but she can certainly have some soft meat, some chicken, some fish, vegetables, soft fruits and melons. And after a few months of healing, once the implants have healed, meaning the bone literally fuses like shrink wrapped around the implants, at that point she'll go back and see her dentist, who will make her a more highly refined restoration that will last longer.
Wow. That's amazing. Hey, we're going to go to break, and we come back. I know I got to talk about this pain tolerance. Dr. Jeff does this very well because people think it's going to be really painful. And that's probably keeps people from picking that phone up. So we're going to talk about the pain tolerance. We'll be right back.
Get your smile ready for summer. Are you missing teeth? Do you have loose teeth? Can you bite into an apple? Is your smile ready to hit the beach this summer with confidence? We all work out and try to look great since we live in paradise. You need a smile to match. The South Florida Center for Periodontics and Implant Dentistry can help you replace those failing or missing teeth with a beautiful smile and the confidence you deserve. The doctors at the South Florida Center for Periodontics and Implant Dentistry have helped thousands of patients rejuvenate their smiles for nearly 30 years by replacing failing and missing teeth with dental implants. Often new teeth are replaced the very same day using the technique they pioneered more than 15 years ago. Teeth today. At the South Florida Center for Periodontics and Implant Dentistry, all of their doctors are board-certified dental specialists. They have placed thousands of dental implants, and we all know that experience matters. Call the South Florida Center for Periodontics and Implant Dentistry today to schedule your free consultation. Call them at 561-912-9993. You'll be glad you did.
Hey, we're back here with the South Florida Center for Peridontics Implant Dentistry. We're here with Dr. Fred and Dr. Jeff, and I want to go to this pain because people think that this is really going to be painful. I mean, do I really want to do this? Have at it.
The answer is it's not painful. We use local anesthetic. We have an anesthesiologist if you want to go to sleep. If you want something intermediate, we have all sorts of other capabilities to sort of take your head out of the game a little bit. But typically, while we're doing the treatment, not typically, always while we're doing the treatment, there's no pain.
Wow.
Afterwards, we are really good at making sure you don't have much. You're going to have some discomfort. It's going to swell. You're going to feel uncomfortable, but you will be functional and you will not be in a lot of pain. A lot of our patients.
You can go back to work the next day.
You can certainly, if it's a small procedure, you absolutely can go back the next day. If you're doing a full arch, meaning an upper jaw or a lower jaw or the whole mouth, there's going to be more discomfort associated with that. And you're probably also going to have a sedative, so you're going to want to sleep and you won't be so sharp. Bottom line is, you're not going to be in pain. You're not going to feel like you got hit by a truck. And that is the perception, but it doesn't happen that way.
I would think Fridays would be a busy day for you because people take off for the weekend rather than having to go back to work the next day.
Yeah, we probably tend to do more procedures later in the week because that gives people the weekend plus, sometimes plus a day to really feel good. But the reality is we do these procedures all week long, and it all depends on
So,
what
you know,
need.
we have snowbirds here, and they always come in about October, November. So I would think that's when you're starting to get really busy. Is that true?
Things tend to pick up after the snowbirds return.
But between now and October, if you're thinking about this, Don't wait till November or December, because you're not going to probably be able to get in as soon as if you do something now. Is
No,
that correct?
what you're saying is absolutely correct. They're all
All the snowbirds are back home.
right. We're still busy this time of year, but we have more gaps or shorter wait times to schedule, particularly for bigger procedures. The wait times are a little shorter now than they might be in the winter or in the fall. The other nice thing, and we talked about this years ago, was smile for the holidays. In other words, if you do the work now, you're going to eat turkey at Thanksgiving. You're going to be able to smile with your family at Hanukkah and Christmas.
Yes.
If you wait until the week before Thanksgiving, you're going to eat, but you're not going to be quite as comfortable as if you took care of it today.
Well, I'm going to go back to something I just think is amazing. Because my sister had implants about 8 years ago in Dallas. It literally took 4 months. It's a long time. You can do it the same day.
We're going to most of the time we're going to give you teeth the same day.
Right. And I know everybody's not the same.
Yeah, there are some exceptions to that, but
That's amazing.
We're really good at keeping you going and getting you teeth the same day. They're not going to be as strong day one as they will be after 2 or 3 or 4 months, but you'll get them, you'll smile, and they're not coming out.
Did you hear that word? You will be able to smile. I think what's the great thing about your practice is you guys are very good at what you do. You know what you're doing. People can feel so safe with you. And we've kind of gone through, you're not looking at a lot of pain, unless you have to have extensive work. And,
you're
like
still
you
not
said,
looking
it's
at a lot
still
of pain.
not looking at that.
One thing I'd say about pain, just to interject for a second, is you have to remember a lot of our patients are coming to us already in pain. And so, in fact, it's just the opposite. We're switching things around. We're getting people out of pain. And so a lot of our patients, particularly those that are dentally exhausted, they've been from one dentist to another. Nobody's been able to solve their problems. The nice thing about what we do is we're actually getting people out of pain. Will there be discomfort afterwards? Of course there will. There's going to be soreness, but as Jeff said, it's managed for the most part with over-the-counter medications, once in a while one narcotic, one pill or two, but nothing extraordinary. These are people that have been living with pain for a long time.
I think it's amazing, though, that you can walk in and walk out with teeth. But the smile thing really gets me, because I have friends that they definitely had and theirs were in the back.
Yeah.
Sure.
So you wouldn't think, but when they smile or laugh,
You see it.
it stands out. I mean, I hate to say it stands out.
Sure.
And now this is almost like life-changing.
Well, we judge one another.
Wouldn't you say? I mean,
we judge each other by our smile. So
of course, yes.
either
Imagine
you're-
out there looking for a job, and you have to
Right.
worry about a smile.
Right.
And there's a lot of people out there looking for better jobs now, because they're out there, they're available, and you don't want to smile like some weirdo because you're missing a tooth. It's okay. It happens to all of us. But here's a way to get it taken care of by 4 of the best dentists in South Florida.
Right.
And a lot of people, unless you've had, if you've had the gum disease, you don't really know what periodontics are. So kind of explain that to them. Because sometimes that's where it starts, right?
A lot of times,
That's when you start losing teeth.
The most common reason adults lose teeth in the United States is periodontal disease or gum disease.
Okay.
And the last estimate that came out was that 50% of the population, that's half the adults in the United States, have some degree of gum disease.
Wow.
So there's a tremendous amount of that. Gum disease is an infection that starts at the gum line, and then it eats away at the jawbone, eventually causing teeth to get loose, and
Because it's
ultimately
rotting with the bone.
it
Exactly.
infects and attacks the bone. And it's complicated as to how it happens, but the bottom line is it's bacteria, it's an infection, and it causes teeth to loosen and then ultimately either need extraction or fall out. And what's kind of shocking about it is it doesn't hurt. It's almost symptomless unless you're very subtle. So you may find that you have bad breath. You may find that your gums bleed when you brush. If you brush hard, a lot of people say, well, I'm not going to brush hard and I won't find it. Well, that just allows this to continue. People who have a dentist and they think they're managing their pockets, they're probably not. And this is probably getting worse until it reaches a level where you have some serious problems. The other side of our practice, part of it is replacing teeth, when they're gone. The other side of it is saving and fixing teeth when they're still manageable. So those are the two sides of the hat that a periodontist wears.
Do you do the extraction, or does...
Yeah, no, we do it.
We
Okay.
do extraction.
So sometimes there's teeth you can't save.
Correct.
So those have to be extracted.
Correct.
And then you really need the implants in.
Correct.
And a lot of times we'll do all that at one time, so you don't have multiple procedures, you don't have multiple waiting times. You lose a tooth, you get an implant, you get a new tooth on it the same day. It's just that simple. It's a continuum. All happens right there.
We only have a few minutes left. I'm going to ask you a question that I love asking. I'm not trying to embarrass anybody. Tell me why I should come to your practice. I need work done. I've got to have 2 new teeth put in. Why should I come to you?
We're really good, and we really want to take care of you.
And
We have a lot of integrity. It's important to us that you get a good result today, and you keep it 10 years from now, 20 years from now.
And experience counts. The fact of the matter is we have experience. We have placed tens of thousands of implants. We've obviously had primarily success, but we've dealt with the problems also, be it our own or somebody else's. So we are keenly aware of how to problem solve and how to make sure that if there is an issue, we're going to fix it, whether it's our problem or somebody else's. And it's important to us that you have a good outcome.
Here's something I rarely say. These guys right now could be doing their implant work. They're here. This is a way of giving back, which I think is incredible. Here we are, big hours of the day, and you're here doing this show, which can't tell you how much we appreciate. But this, to me, shows you how much you care. So, man, I love
Thank
doing
you.
the show. You guys will be back with us again next month. Give everybody your phone number.
561-912-9993
And your website.
is flsmile.com.
Listen, tomorrow, get on the phone tomorrow, maybe this afternoon even. I'm telling you, once you have this done, it will change your life. Sound like a preacher now. Anyway, we're going to be back next week with more Ask the Experts, and everybody have a great weekend. We'll see you then. Peace and love.
Thanks for listening to the Ask the Experts show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve-O. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management,